NIH, National Institute of Allergy and Infectious Diseases. Aerial shots show NIH campus buildings. Get to know Camila Odio, Clinical Research Fellow, Infectious Diseases.
The NIH is kind of like a candy store for kids. You know, you can show up and there's amazing opportunities all over the place. As part of my medical school, I did a year of research at NIAID, and that was my introduction to NIH. I had such a wonderful time as a medical student that I decided I really wanted to come back for fellowship. As the principal investigator of a vaccine trial, I spend parts of my days seeing participants, screening them, assessing them, vaccinating them, and then seeing how they're doing after vaccination, assessing safety, looking at the data from the trial. The clinical center is also an incredible resource. The nursing staff is phenomenal. They're very patient-centered, very precise, which is very important for clinical trials. So the goal of our study is to compare the immune response and safety of our vaccine in people who have not versus people who have had dengue before. And we're doing very detailed analyses of the immune response in each individual to then compare how does your previous history of dengue determine how much your body responds to the vaccine and what immunity you develop, both in the blood and in the lymph node, which is where the education of the immune system really happens. So this will allow us to better understand dengue responses and hopefully make vaccines that can protect everyone, regardless of their history of previous exposure.
B-roll photos show NIH staff at work in labs and clinical settings.
Launching a clinical trial is very expensive and very complex, but NIH and the clinical center are set up to do it. I think NIAID really exemplifies dedication to mentorship, and no matter how senior and exemplary scientists and physician investigators are, they always make time for the next generation of scientists, and I've really benefited from that. There's dedication across the board, no matter what department you're working with, pharmacy, interventional radiology, nursing, to really optimize your opportunities and optimize your research so that you can answer big questions that other people just haven't had the chance or resources to answer. I think the collaborative spirit of NIAID is also pretty unique and really valuable. Both when I was working in fungal diseases as a medical student and now when I work in viral diseases, we're able to connect and work with experts from around the world. And part of that is just being at NIAID, people want to work with you. And so we're able to really leverage a wide variety of skill sets from across both NIAID and outside of NIAID to advance our science all the more. There are resources at NIH that are pretty unique, and the people that manage those resources are very enthusiastic to collaborate, and I think that allows us to do really wonderful cutting-edge science that you really could not do on your own.
Visit www.niaid.nih.gov.